Hello, everyone. Thanks for joining our webinar today on neck pain. I just want to know how you found out about us first. My name is Dr. Kerry Yerkew, and if you could put the method of how you found out about our webinar in the chat window right now, that would be great. We are going to talk about neck pain. How many of you have neck pain today? Please write a note in the chat window for me, just so I know how many of you are having neck pain or have associated symptoms with neck pain. Okay, great. I'm just going to turn off the video. I'm going to go to the next slide. And my name is Dr. Kerry Yerkew. I'm a chiropractor in Kelowna. I have practiced for 26 years, and I saw a chiropractor when I was young, so that really helped me and was one of the major reasons I became a chiropractor. I wanted to help other people like this chiropractor helped me. I practiced primarily in Winnipeg for the first 15 years, and then the last 10 years I was in Penticton. Recently, our family moved up to Kelowna for my children to go to university, so I've started a new practice in Kelowna, and we are taking new patients. We have flexible hours. We're open late until 7, and then we're open weekends as well. Well, let's talk about neck pain. So neck pain comes from the top 7 vertebrae, which is called the cervical spine. The cervical spine is composed of C1 at the top, all the way down to C7 at the bottom, and it forms a curvature that actually goes into the body called a lordosis. How does neck pain start? Well, neck pain starts from an injury, like an accident or a fall. Could start from something like whiplash, where you're in a car accident and the head goes forward and back, causing strain to the neck area. It could come from repetitive strain. If you're working in a certain capacity, continually straining your neck, that could cause problems in the neck area. Could be caused by poor posture, slouching, text neck, having your head down, looking at your workstation. And sometimes it just comes on spontaneously. Patients come in with neck pain and they don't know how it started. I wrote a book on neck pain and published that last year. It is on Amazon, and I'll put the link in the follow-up email that we send to you. That book is on neck pain and what I experienced as far as helping patients over the years with neck pain. It includes headaches and whiplash and concussions, because what I'm finding is there's more and more concussions with sports, and it's more well recognized now, whiplash with car accidents, and headaches as a result of pressure on the nerves and pain from the upper part of the neck into the head region. So if you want to get that book, you can definitely go on Amazon, and it is on Kindle. You can get the e-reader. There is an audiobook, and you should be able to get it on Kindle Unlimited as well. So let's review the anatomy and physiology of the neck. So there's 7 segments in the neck. The neck is very freely movable. It's got the greatest range of motion of any area, but it has the head sitting on top. The head is very heavy in relation to the neck, so moving the head quickly, like in the case of a whiplash car accident, the head can be very heavy and whip forward and backward like a pendulum and really strain and stress the neck joints. There's nerves coming out of the neck, one set of nerves on the left side of the spine, one set on the right side. So those nerves can get pressure, causing pain. The joints have nerve endings in them, and poor alignment and function of the joints in the neck can cause pain as well. Often the body will tighten up as a protective mechanism, so the muscles will tighten, sometimes even splint, to stabilize and protect the neck area after an injury, and that limits the range of motion further. And then, of course, swelling and referral of the pain into different areas is definitely possible. Well, what's the process in our clinic as far as assessing neck pain, and how can we help? Well, first, when someone comes in with neck pain, we do a thorough history to find out about previous injuries, episodes of neck pain, and other health-related issues. Secondly, we do an examination and we fully assess the spine to determine what the problem is. This may involve checking the posture, the alignment, the range of motion, and doing special tests like orthopedic or neurologic tests. Then we'll form a diagnosis and let the patient know what we found out, what the cause of their pain and discomfort is. And then we'll recommend treatment. So basically what we're going to do to help, and then instruct the patient what they can do to help as well. When we assess the neck, we go through ranges of motion. So we look for any deficiencies in bending and twisting. We look at the overall alignment, the posture, and look for any changes to the posture and the way the neck is being carried, the way the head is on top of the neck, the shoulders. We look at the posture from the side as well as the back and the front. And then palpation, we check the neck bones to find out what kind of alignment they have and see how they're aligned in relation to each other, so one on top of the other. How do we treat neck pain? Well, we do adjustments, and we do those adjustments gently with hands-on techniques, or we use instruments like an activator or an integrator, these instruments to move the bones into a better place gently so that the patient feels better. We give patients advice on proper posture, stretches, and lifestyle changes to support the work that we're doing in the office. Today, actually, I had one of my first telehealth visits where I had prescribed to a patient stretches to do at home. And then we used a new secure platform to follow up and see how she was doing with that, answer her questions. And so I find telehealth being a wonderful add-on to the care we're giving patients in the clinic. And then follow-up. We follow up with patients, schedule appointments initially closer together, but as the patient starts to get better, farther and farther apart, and then eventually we recommend checkups to make sure everything's staying the way it should. Sometimes in the clinic I'll give neck stretches, and it's usually after care has started. At some point in care, the patient can get active in helping the rehabilitation process. So after treatment started, maybe a couple weeks, 2 or 3 weeks into care, I'll give patients stretches, and I'll usually give specific ones, not all of them, but depending on their injury, they may do 1, 2, or 3 of these stretches, and then I'll follow up with them to see how it's going. We might expand to more stretches than just these as the treatment progresses. We also recommend things like ice and heat, sleeping positions, nutrition to help the body heal. All of those things are part of the recommendations we make. If you have neck or back pain, call our office for an appointment. We are accepting new patients in Kelowna. Our phone number is 250-486-0062. We are located on Dixon at 1628, Dixon Unit 105. It's on the main level, and the clinic, as you come in the front doors, it's on the left-hand side. If you have any questions, don't hesitate to email me. It's drkerryurq@gmail.com. I want to thank everyone for coming today. If you have any questions, don't hesitate to ask. You can put that in the chat window right now. And then I look forward to seeing you next time or in the clinic for an appointment.